everyone. Today I'm going to talk to you about a relatively common but fairly unknown disease called Sjögrens. So Sjögrens also happens to be one of my invisible diseases that I write about in Girl on a Gurney. Sjögrens is a very common disease. It's actually the second most common autoimmune disease, right behind rheumatoid arthritis, but it's so unknown in the general population as well as in the medical community. So you've likely heard of lupus, rheumatoid arthritis, these types of diseases, but this may even be the first time you're hearing the term Sjögrens. Sjögrens is a complicated disease, not just by the way that it attacks the body, but also with the circumstances surrounding the disease, like who gets it and when, which I'll go into in just a minute. So Sjögrens, like other autoimmune diseases, create a large inflammatory response throughout the body. Specifically with Sjögrens, there's also destruction of moisture-producing glands. And again, these are all over the body as well. So Sjögrens is a systemic disease that can cause damage to any organ. So the most common symptoms with Sjögrens are dryness, specifically dryness in the mouth and in the eyes, as well as fatigue, joint pain, muscle weakness. There's a whole laundry list of these symptoms, but those are the most common. I want to express that Sjögrens is much more than just an annoying dryness. Actually, research studies have shown that specifically with the eye dryness in Sjögrens, it's comparable to the disability of angina, which is chest pain caused by a lack of blood flow to the heart. So it's very, very, very bothersome and disabling. The circumstances surrounding Sjögrens that make it even more complicated and more invisible that I mentioned a minute ago include the fact that this is a very female-dominant disease. Actually, 90% of all Sjögrens sufferers are female. That makes it one of the most female-dominant diseases in medicine. Also, the fact that the most commonly diagnosed age group is actually from the 40s to the 50s. And unfortunately, we know how society views and treats middle-aged women. Yes, middle-aged women, which I fall into that category, are highly scrutinized and are viewed upon very negatively, especially when compared to males in that same peer group. For instance, let's take graying hair, which I have some. So women that have graying hair are often viewed as old and decrepit, while our male counterparts are viewed as powerful and distinguished, right? There's been a lot of this talk going on in the news lately with celebrities about women that have let themselves go when it's just part of the natural aging process. So as I said before, what's happening in our culture is also happening in medicine. So it shouldn't be a big surprise that Sjögrens is a poorly funded autoimmune disease, and the fact that there is not one FDA-approved medication, despite the fact that the disease was actually identified nearly 100 years ago, speaks volumes. So there's not one medication approved for the systemic symptoms of Sjögrens. There are some in the pipeline, but they are still quite a few years out from being approved. The fact that there's a huge research gap, and Sjögrens is not the only female-dominant disease that has been affected by this. So crumbs of research money are being given to these female-dominant diseases, despite the fact that they're disabling, that they affect millions of women. So I am one of those millions of women that has been disabled from this disease. But yet again, it still does not get enough attention. So I write about this in my book. I will give specific examples as far as which diseases. So there are many diseases that are not female dominant, so male dominant, or that are more equally affected, that more equally affect males and females, that get tons more money. So this research gap not only leads to a lack of treatment, which leads to a poor quality of life, but ultimately it leads to misunderstanding, especially among the medical community, which is scary. So, for instance, in 2015, when I went to the doctor, I was completely dismissed. I was terribly sick. And one of the reasons that I believe this happened is because there's such a lack of knowledge for our healthcare providers, because there's a lack of research money and a lack of research. So we really need to change this. And how we can change this is through awareness, obviously through governmental legislation changes. Celebrities like Venus Williams and Carrie Ann Inaba have come out with their Sjögrens diagnoses, which has been great for the community. However, much more needs to be done, because this is the redheaded stepchild of autoimmune diseases. My best advice for you is, if you have Sjögrens or think you have Sjögrens, or your loved one does or may have, get to the right specialist. So you cannot just consider every rheumatologist a specialist for Sjögrens. It's unfortunate, but there's much misinformation even among rheumatologists about the disease. So really, I mean, I am a patient of a local general rheumatologist who's very knowledgeable about Sjögrens, and I'm also the patient at a Sjögrens center in Philadelphia. So do not assume that just because your doctor is a rheumatologist that they understand the disease. And don't take the word of the receptionist, so you have to do research. And this is where you have to really put time in and talk to others. That's so very important. Do not compromise your health. And you will compromise your health if you are seeing a provider that does not understand Sjögrens or whatever disease that you are battling with. So, well, thank you so much for listening. I hope to have an update about publishing very soon. And please remember to like and subscribe. My next video will be on another one of my invisible diseases, endometriosis. Be well.